If you're testing for the NCLEX in the United States, this video is for you. We're practicing infection control and safety questions that reflect the real NCLEX exam. Which is an early sign of infection? Correct answer is B. Tachycardia. Rationale: increased heart rate is an early systemic response to infection. Which client requires neutropenic precautions? Correct answer is B. Client receiving chemotherapy. Rationale: chemotherapy suppresses bone marrow and reduces white blood cell count, increasing infection risk. Which action best prevents surgical site infections? Correct answer is B. Administering prophylactic antibiotics. Rationale: timely prophylactic antibiotics reduce bacterial contamination during surgery. A nurse sustains a needle stick injury. What is the nurse's first action? Correct answer is C. Wash the area with soap and water. Rationale: immediate cleansing reduces the risk of pathogen transmission after exposure. A nurse is caring for a client with active pulmonary tuberculosis. Which personal protective equipment is required? Correct answer is B. N95 respirator. Rationale: tuberculosis is transmitted via airborne particles. An N95 respirator filters small airborne organisms and is required to prevent inhalation. Which measure helps prevent cross-contamination? Correct answer is B. Dedicated client equipment. Rationale: client-specific equipment prevents microorganisms from spreading to others. Which client should be placed in a private room? Correct answer is C. Client with MRSA infection. Rationale: MRSA is highly contagious and requires contact precautions and isolation. A nurse should use soap and water rather than alcohol-based sanitizer in which situation? Correct answer is D. After caring for a client with C. difficile. Rationale: alcohol-based sanitizers do not kill C. difficile spores, soap and water are required. Which intervention is most important when caring for a client with sepsis? Correct answer is B. Monitoring vital signs frequently. Rationale: early detection of changes in vital signs allows prompt intervention for life-threatening deterioration. A nurse is caring for a client on airborne precautions. Which room setup is required? Correct answer is C. Negative pressure room. Rationale: a negative pressure room prevents airborne pathogens from escaping into surrounding areas. A client with Clostridioides difficile infection should be placed on which type of precautions? Correct answer is D. Contact precautions. Rationale: C. difficile is spread by contact with contaminated surfaces. Gloves, gowns, and hand washing with soap and water are required. A nurse caring for a client with diarrhea should prioritize which action? Correct answer is B. Strict hand hygiene. Rationale: diarrheal illnesses spread easily through contaminated hands. A client with shingles requires which type of precautions? Correct answer is D. Airborne and contact precautions. Rationale: shingles can spread through airborne particles and direct contact with lesions. Which nursing action is most effective in preventing healthcare-associated infections? Correct answer is C. Performing hand hygiene. Rationale: hand hygiene before and after patient contact is the single most effective way to prevent infection transmission. A nurse notices a break in sterile technique when which action occurs? Correct answer is A. Sterile gloves touch below waist level. Rationale: anything below waist level is considered non-sterile and contaminates the sterile field. Which client requires droplet precautions? Correct answer is C. Client with influenza. Rationale: influenza is transmitted via respiratory droplets and requires droplet precautions. Which action best reduces the risk of aspiration? Correct answer is B. Elevating the head of the bed during meals. Rationale: upright positioning helps prevent food or liquid from entering the airway. Which nursing intervention best prevents pressure injuries? Correct answer is B. Repositioning every 2 hours. Rationale: frequent repositioning relieves pressure and promotes tissue perfusion. A nurse discovers a fire in a client's room. What is the nurse's first action? Correct answer is C. Remove the client from danger. Rationale: according to race protocol, rescuing the client is the first priority. Which action demonstrates proper glove use? Correct answer is C. Removing gloves before leaving the room. Rationale: gloves must be removed to prevent the spread of microorganisms outside the client's room. A confused client attempts to climb out of bed. Which action is safest? Correct answer is C. Place the bed in the lowest position. Rationale: lowering the bed reduces fall risk without restraining the client. Which order should the nurse remove PPE? Correct answer is A. Gloves, gown, mask. Rationale: gloves are removed first because they are the most contaminated. Which action violates standard precautions? Correct answer is B. Recapping needles. Rationale: recapping needles increases the risk of needle stick injuries. Which intervention is most effective in preventing falls? Correct answer is D. Hourly rounding. Rationale: hourly rounding anticipates client needs and reduces fall risk. A client with an indwelling urinary catheter is at risk for which complication? Correct answer is B. Urinary tract infection. Rationale: indwelling catheters provide a direct route for bacteria to enter the bladder. Which client is at greatest risk for developing an infection? Correct answer is A. Older adult with poor nutrition. Rationale: poor nutrition and advanced age weaken immune defenses, increasing infection risk. A nurse is preparing to administer an injection. Which action best promotes safety? Correct answer is C. Activating the safety device immediately after injection. Rationale: activating the safety device reduces the risk of needle stick injuries. A nurse identifies a medication error after administration. What is the nurse's priority action? Correct answer is C. Assess the client. Rationale: client's safety is the priority. The nurse must first assess for adverse effects. Which client requires contact precautions? Correct answer is C. Client with MRSA wound. Rationale: MRSA spreads through direct contact and contaminated surfaces. Which intervention reduces the risk of catheter-associated urinary tract infection, CAUTI? Correct answer is C. Maintaining a closed drainage system. Rationale: a closed system prevents bacteria from entering the urinary tract. A nurse enters a client's room and smells gas. What is the nurse's first action? Correct answer is C. Remove the client from the room. Rationale: removing the client from danger is the top priority in safety emergencies. Which client is most at risk for falls? Correct answer is C. Client with visual impairment. Rationale: visual deficits impair environmental awareness and increase fall risk. A nurse should don gloves when? Correct answer is C. Contact with body fluids is anticipated. Rationale: gloves are required when exposure to blood or body fluids is possible. Which sign indicates improvement in an infection? Correct answer is B. Decreased body temperature. Rationale: a reduction in fever suggests resolution of infection. A client reports dizziness when standing. Which safety instruction is most appropriate? Correct answer is A. Sit before standing. Rationale: changing positions slowly helps prevent orthostatic hypotension and falls. Which action by the nurse helps prevent medication errors? Correct answer is B. Using two client identifiers. Rationale: two identifiers ensure the correct medication is given to the correct client. Which client requires protective, reverse, isolation? Correct answer is B. Client with leukemia and neutropenia. Rationale: neutropenic clients need protection from environmental pathogens. Which intervention best reduces the spread of multi-drug resistant organisms? Correct answer is A. Limiting antibiotic use. Rationale: overuse of antibiotics contributes to resistant organisms. A nurse is disposing of contaminated linens. Which action is correct? Correct answer is B. Hold linens away from the body. Rationale: this reduces the spread of microorganisms and contamination. Which situation requires the nurse to complete an incident report? Correct answer is C. Client fall without injury. Rationale. All falls must be documented to improve safety and prevent recurrence. Which action best prevents oxygen-related fires? Correct answer is C. Posting no smoking signs. Rationale: oxygen supports combustion and increases fire risk. Which intervention promotes safety for a confused client? Correct answer is A. Frequent reorientation. Rationale: reorientation reduces anxiety and unsafe behaviors without restraint use. Which factor increases the risk of infection in hospitalized clients? Correct answer is B. Invasive procedures. Rationale: invasive devices bypass natural defense barriers. A nurse should remove PPE when? Correct answer is B. Inside the client's room. Rationale: PPE should be removed before leaving the contaminated area. Which safety device helps prevent wrong site surgery? Correct answer is A. Surgical checklist. Rationale: checklists verify correct client, procedure, and site. Which nursing action reduces aspiration risk in tube-fed clients? Correct answer is B. Checking gastric residuals. Rationale: monitoring residuals helps prevent regurgitation and aspiration. A nurse should report which condition as a sentinel event? Correct answer is B. Client fall with injury. Rationale: sentinel events involve unexpected outcomes causing serious harm. Which action best prevents spread of respiratory infections? Correct answer is B. Covering coughs and sneezes. Rationale: respiratory hygiene reduces droplet transmission. Which client is at highest risk for aspiration pneumonia? Correct answer is A. Client with dysphagia. Rationale: difficulty swallowing increases the risk of food entering the lungs. Which action demonstrates proper use of restraints? Correct answer is B. Removing restraints every 2 hours. Rationale: regular removal prevents injury and maintains circulation. Which intervention reduces hospital-acquired infections? Correct answer is A. Shortening hospital stays. Rationale: less exposure time reduces infection risk. Which nursing action ensures safe oxygen therapy? Correct answer is B. Securing oxygen tanks upright. Rationale: proper storage prevents tank damage and injury. A nurse notes redness and warmth at N4 site. What is the priority action? Correct answer is C. Discontinue the 4. Rationale: signs of infection or phlebitis require immediate removal of the 4. Which practice reduces the risk of workplace injury? Correct answer is C. Using proper body mechanics. Rationale: proper techniques protect nurses from musculoskeletal injury. Which client requires airborne precautions? Correct answer is B. Client with tuberculosis. Rationale: TB spreads through airborne particles. Which action best prevents contamination of a sterile field? Correct answer is C. Keeping the field in view. Rationale: sterile fields must remain visible to ensure sterility. Which nursing action reduces fall risk at night? Correct answer is C. Providing night lighting. Rationale: adequate lighting improves visibility and prevents falls. A nurse should suspect infection when which lab value is elevated? Correct answer is B. White blood cell count. Rationale: elevated WBCs indicate an immune response to infection. Which action prevents spread of blood-borne pathogens? Correct answer is B. Proper sharps disposal. Rationale: safe disposal prevents needle stick injuries and disease transmission. Which principle guides all safety interventions? Correct answer is D. Least restrictive measures. Rationale: safety interventions should protect the client while preserving autonomy and dignity.